I see epigenetics and epigenetic drugs as being central to any cancer therapeutic regimen. Why? Well, epigenetic therapies by themselves are unlikely to be a panacea for very much, okay? Because cancer cells are too intelligent for this. They will evolve, they will adapt, and they will find ways to become resistant to any single drug. However, that adaptive process, the way the cancer cells adapt to any therapeutic challenge, really requires you to reprogram the way your DNA is expressed. So there's massive gene expression changes that happen. And this is where epigenetic regulators come into the fore. So if we're able to constrain or direct that adaptive response, then we have a chance of exposing new vulnerabilities. So the future, I think, of epigenetic therapies is in being able to use them intelligently to make cancer cells make decisions that we want them to make, expose new vulnerabilities that we can then attack to get more effective gains for our patients. And so a blood test. Okay.
So from the blood, you can actually start.
Yeah, exactly. So the research was done in. I think the future is very bright. You know, we over the last 5 years have been able to develop small molecule drugs that can very specifically go and inhibit aspects that go wrong in cancer driven by epigenetic regulators. Some of these drugs have started to enter clinical trials. We run some of those clinical trials here at Peter Mac. And the results are just starting to come through. And the results say that there is cause for optimism. Okay? What we now need to do is think about how best we use these agents. How do we combine them with what we already have, be it as conventional chemotherapies, be it as immunotherapies, be it as other targeted therapies, to get the most effective gains for our patients.